Bismillahirrahmanirrahim. Assalamu alaikum. Today we will discuss an important short case of single joint examination. Your command will be do knee and relevant joint examination. Introduce yourself and take informed consent. Exposure should be up to mid thigh. Our child should be in panties. Warm your hand if outside is cold. Then do inspection of joint up to 10 seconds. Look for swelling, redness, any bruise, and any discharging sinus. Look for disuse atrophy of the muscle or any deformity of the joint. Then ask for gait. Keep along with patient if he is having difficulty in walking. Gait would be intelligible. Then make him sit. Ask for maximum area where patient feel pain. Start examination away from most affected site to give sense of assurance to the patient. Must look at the face of the patient while you are examining the joint. Now compare both joint, feel temperature with dorsum of your hands. Then check for swelling localized to joint cavity or outside the cavity. Do suprapatellar tenderness. This we do to check bursitis, tendinitis, osteomyelitis, and septic arthritis. Place both thumbs just above the patella and press thumbs against that area. Then do milking knee sign. This is the favorite sign of the examiner. Positive in hemophilia for effusion. Started from above the joint with radial border of the thumbs and index finger. Joint should be in 30-degree position. Then do active and passive movement at joint. When joint is too much inflamed, do only active movements. Say the patient to do flexion and extension of joint and note the degree of restriction of the movement. Do examination of other joint too quickly. If you will not do this, it should give clear cut message to examiner that you know the case already. So do examination of interphalangeal joint, wrist joint, elbow, shoulder, hip and ankle joint and do all range of movements. This is the comparison of your three differential diagnoses. In septic arthritis, swelling is localized to cavity, while in hemophilia, swelling extended outside the cavity, while in JRA, swelling is localized to the cavity. Suprapatellar tenderness is present in septic arthritis but not present in hemophilia and JRA. Sign of inflammation is present in septic arthritis and JRA while not present in hemophilia. Movements are severely restricted in septic arthritis, restricted to somehow in hemophilia, and also restricted in JRA. Now do the relevant examination. Check hand for pallor, also check pulse, BCG to rule out tuberculosis, temperature for septic arthritis, lymph node for tuberculosis and JRA, eyes for JRA, chest examination for effusion for tuberculosis and JRA, abdomen for hepatosplenomegaly for tuberculosis and JRA, petechia and bruises, then do height and weight. Cover the patient at the end and say thanks to the patient. Now give brief description. 8-year-old child quiet cooperating during my examination having marked swelling of the right knee joint with obvious bruises on right side of the knee joint. Patient having antalgical gait though there is no active sign of inflammation. Milking sign is positive and patient having restriction of movement of flexion at 45 degree and extension at 30 degree. There is no suprapatellar tenderness, disuse atrophy, deformity of joint, or any discharging sinus. Upon extension of my examination, there is no lymphadenopathy or hepatosplenomegaly and patient is afebrile to touch. On the basis of my examination, my differentials are hemophilia, septic arthritis, oligoarticular GIA, and tuberculous arthritis lower down. I do some specific and some sportive investigation. Just name the investigation, like I will do CBC with ESR, blood culture, anti-nuclear antibody and RA factor, PTA PTT, Mantoux test, factor 8 and 9, X-ray and MRI joint. Now, if he ask about any test, then describe. Like he ask about X-ray and finding of MRI joint. So you can say that soft tissue swelling and decreased joint space can be appreciated in X-ray, while in MRI joint erosion and new growth of the epiphyseal plates, hemorrhage, subchondral cyst, osteophytes, and sclerosis can be present in MRI of the joint.